It should be covered already. The cap. You will clean it. We can see that we are clean it. Swipe it. Of course, gloves.
Can you just teach them how to clean it? Because
Okay.
actually, there is two products to use to clean the hub of a catheter. It's either a close swab
Or a cleaning.
exactly, or a cleaning sponge. It's called. We have the touch scrub. It's called touch scrub.
I will make sure that it's clamped here. There is no backflow for the blood.
Exactly.
Okay. Remove the cap. Make sure it will be sterile. So it's better to put it like that. Wipe it. Okay. Okay.
Excellent.
Make sure that there is no air.
Keep it in second.
Keep it until dry.
Yes.
Okay. Connect your syringe.
1, 2, 3.
Okay. Open the clamp. And no, I'm not pushing.
It's okay. Go.
Okay. Then you can patent, no resistance.
Yes.
Okay. Then خلاص.
So you need to keep flushing for the whole thing. So, but you,
Yes,
you
yes,
just
yes,
you're
yes.
just showing us
Showing
that
how
the
to use
technique,
it.
Yes.
Okay.
So you need to keep push pause until
Yes.
you are done with the whole syringe, and then you will inject medications, whatever medication you will need to do that, and then afterwards, the first part that he said, which is very important, make sure that the patency is there. So basically, don't push it. Don't try to force flushing. Don't try to force it. If there is any problem with flushing, it's not going very well, you need to go back and ask the doctor to check the catheter or whatever the policy is inside the hospital. So this is the most important part, because otherwise maybe there is clot, maybe there is a problem with the catheter, maybe there is anything that could be occurring, and then we are not doing correctly. Maybe we ruptured the catheter without knowing. So we need to make sure that patency is there, everything is fine, there is no resistance, and everything is working proper to keep going with the flushing. Otherwise, we stop, call the supervisor, or call the doctor, or whatever the guidelines in the hospital say. So, as Rami. So as Rami said, so the cap is here. We remove the cap, we do the flushing, push-pause technique, and then inject the medication, all right? And then we go back to flush it again, and then we clamp it as the 0.5 ml, last 0.5 ml is being injected, and then we go back to the same cap, or if there is blood withdrawal, we change the cap. You need to change the cap whenever there is blood included, and you need to change the cap whenever possible, or whenever you change the dressing. Yeah. So basically, as per the guidelines of the hospitals, you can go in with changing the cap as well. All right. As you saw, he cleaned it from outside. This is what we clean. So basically, there's a side scrub that cleans from inside, but that's not actually needed. You can use alcohol swab, and you would be fine this way. So this is the most important part of the flushing. Who wants to try it? So basically, okay, one by one we'll try it. All of us will try it. So basically, who wants to start? This is the point. Okay, no one is starting. Self-initiative, guys. All right, I'll be calling someone. Yeah, okay. Can you try it? Can you try it? Please? Yeah, just flush. That's just easy. Easy. No, that's fine. No need. Just, we are dealing with only the part of flushing now. We're not dealing with the whole process.
already attended.
Yes.
And the cap there.
Yes.
Still no audio, rejoined couple of times.
All right. Yeah. I'm just gonna hold.
Sir, Can you increase your voice?
Can you make your
Okay,
voice
I will,
louder?
I will try to now.
Okay.
Push, pause, pause, no, pause, push, pause, push, pause, gentle push and then pause. Yes, keep, that's it. All right, that's good.
Excuse me, sir. May I interrupt?
Yes,
I just have one clarification.
Yeah.
Actually, this Puros is actually with chlorhexidine inside, right?
Yeah.
And that is the purpose that we are using that one is to save time and to keep it
Yeah.
sterile all the time. So supposedly we were supposed to use this one just once, right? Single use.
Okay.
Once opened, we have to discard, right?
Yes.
So as what I have seen in all the demonstration, they are still using
No.
alcohol. So I think we don't need to use that, right?
Actually, as per the guidelines, we need to swap it with alcohol. So this is as per the guidelines.
Yes.
So even if the cap is chlorhexidine, it has chlorhexidine, we need to stick to the guidelines or change the guidelines per the hospital. But I cannot talk about
So it's about
each.
the guidelines.
Yes, it's about the guidelines. So we need to stick to the guidelines. Yes,
Because sometimes we are using this one and sometimes we are using the.
Yes.
this is the-
So it's not risky. So let's stick the guidelines, make sure everything goes well. And what is the harm of using it? There's no harm. So this is the basic question that comes to mind. So do I need to change the guidelines because there's a harm? Or do I need to change it because to reduce like harm? This is changing. So I cannot speak about that. So basically we need to do the swiping before and after. After we are done, we need to swipe it as well before we place the catheter.
It doesn't have anything to do with
No.
We can reuse it.
Sorry?
The Kiro, so we can use it again as
Yes,
long
we
as
can
it's
use it
sterile.
as long as it doesn't touch blood or it does. We don't use any blood withdrawals, but we need to change it regularly. The advisable time would be every time you change the dressing, or as per the guidelines of the hospital. So sometimes hospital change it as per the requirements. So it depends on that. Sorry for that. So now we go back to the flushing again. We need to make sure that we push pause. Why do we do push pause technique? Who would know here? Why don't we just flush it? No.
Avoid rupture of the.
It
The valve?
could be one of the reasons. Yes, actually, sorry for saying no. It could be one of the reasons, but the main reason is to create more turbulence. So if you do push pause technique, it showed, a study showed that this is the most technique that creates the higher turbulence inside the catheter. So the flushing is more efficient. So this is the major point of push pause technique. We need to do something here. Just go on YouTube, and I will try to send you a link or a video just to check how it's done exactly. So basically you calculate or you do the counting or you do the push pause. You can say it in your mind. If you want to say it in front of the patient, it's up to you. But basically in your mind, push pause. Push pause is enough to keep the rhythm correct and the flushing correctly. All right? So this is the most important part. So who wants to do it again?
Gusto mo?
Yeah, we all can do it. Please.
I cannot do anything.
No? That was a long push.
Push,
Yeah. Okay.
push, pause.
Yes.
Push,
Excellent.
pause. Push, pause.
That's excellent. All right.
You guys got that?
Have you got it?
Yes.
All right. So this is the most important part. I'm repeating this because this is actually the most, regime that we do to prevent clotting or to prevent or to increase the patency of the catheter. So if we do that correctly, telling you the patency of the catheter would increase no matter what patient type is, or how many lumens there is, or the size of the vein. So as we do this, things will be better. So this is what we need to do. All right? So to go back one step, can we go back to the steps? What we do exactly? We remove the cap. We make sure it's clamped before we remove the cap actually. We make sure it's clamped. Then we remove the cap, we clean it. Then we do flushing, 10 ml flushing, push-pause technique, and then we inject the medication or withdraw blood that we need. And then we scrub it again, clean it, make sure it's clean. And then we need to actually do the flushing. If it was non-blood product, then we do 10 ml flushing. And the last part, which is the 0.5 ml, we need to lock it by then. And then we go back to the clean it again and close it with the cap, or change the cap as per what you have here as guidelines. All right? So these steps are very important to follow. And if it was blood, as I said, we do it 2 times. All right? So we do the cleaning 2 times. But at the beginning, can we ask not to withdraw blood for the first week into training with the PICC line? So basically, we just use it for medications because blood needs to be more careful with it. So we need to keep the patency high at the beginning, and then we use it for blood withdrawal added. Like in second session, third session, we can use the catheter.
Yes, so did you hear all that? You heard?
Yes.
So if you need blood withdrawal, secondary cannulation.
You said it on the first time we put PICC line, we need to verify if it's arterial or venous, so we will do an EKG prior, after insertion.
Oh,
Okay, so what happens
Ah.
when the doctor goes
Yeah.
in? He needs to aspirate.
Yes.
Okay? So that's
Yes.
the time. You can use that very same sample if that's what you have to do.
Right.
Make sure you have an ABG syringe ready with insertion, and then at the same time let it take. Like when they put in the central line, they would draw that much blood. So if that is the practice they do, then by all means use it at the time, have it ready when he aspirate at first blush. Okay?
Yeah.
That is how he's going to do it. Is
Yeah.
that how they do it?
I guess what he means now is that upon insertion, it's a week to withdraw blood, but just leave it for a
Sure.
week.
For
a week.
At
Yeah.
first,
Yeah,
just
no,
Yeah.
that,
Yeah.
no, that is what he means.
Yes, and this is what I meant. Only
Yeah,
just
yeah.
to practice on it, keep the patency high, and then monitoring how we're doing. Maybe we do something else. Maybe it's not the blood which is the problem. Maybe the patient. We need to exactly
Yeah.
understand
Yeah.
the situation and solve it step by step. Instead of solving everything together, it's not going to work this way. So let's take it step by step. This is the first important part, which is the flushing. I'm going back to that because it's really important. And
So I think what we would want from the doctors is like the sequence. He puts it in, he is aspirating.
Yes.
Before he's now flushing it with a saline and everything, ask him just to aspirate also in your syringe. Or take a little bit how you can, maybe whatever. But once he's flushed, now no more taking a sample. Then it's flushed and ready just for use.
Yes,
Correct? For
yes,
1 week,
yes.
we don't use
yes,
it for
yes,
for
to make sure
samples.
patency is there, everything
Sure.
is solved. So another question here, do we use heparin inside the hospital here? No, we don't use heparin, okay. All right, so because actually when the guidelines say that if we are using open-ended catheter, which is not valved, we need to flush it with heparin. We'll do it flushing, but I'm not gonna do that. So the other part is that these PICCs that
So
we have.
if you do use heparin,
Yeah.
do you use the what strength?
So basically this rate is gonna be upon the pharmacist. So the pharmacist would need to advise that based on the condition of the patient,
Okay.
on the hospital guidelines. So it depends on the pharmacists themselves. They would do that. But that's why if it's like a heparin-free facility, then I would recommend to change to valved ones, valved PICC lines, because this would not need any heparin. Yes. So if we don't need heparin, so this is the way to solve it. Valved ones could be the proper solution.
Did you discuss this one with the physician?
No,
I mean, the
actually we didn't.
intensivist?
No, actually we didn't because honestly, We go to the solo, which is the valve one, when it is outpatient.
Okay.
But here in the hospital, we can actually at outpatients because they stay for a long time. So why don't we go for the valve ones, which the patency is higher? Because the flushing would only be required once a week if it's not being in use.
Okay, I will bring this up with the
Sure.
intensive.
Sure. I can talk to them as well.
Yes,
As per the,
that'd be
yeah.
great.
So I will tell them what the recommendations are.
Thanks.
So for now, we stay, even if we moved to the valve ones, we will stay doing the flushing techniques 24 hours. Every 24 hours is not used until we are sure that everything is implemented and all the PICCs inside the hospitals are involved. Then we will tell you, okay, we can move into flushing every week. But till then, please continue to do the flushing every day. All right? All right. So have you dealt with stat locks before? Do you know stat locks?
It seems
Yeah, we do.
for a lot of them, it's new, but for some that have. So I think if you can treat as if everybody is new.
That's why I'm asking the question. Feel free to say no. We are here to train. We are here to learn. We're not here to judge. This is exactly what we are here for. So this is the stat lock. Stat lock is the locking device, the stabilization device. Sorry, not the locking. This is the stabilization device for the catheter. So as we know, when the catheter is inserted, we either suture, the doctors either suture or use stabilization devices, which are the most common at the moment. So they all use stat locks instead of suture these days, for so many reasons. We're not going to go for that. But basically, stat locks are very important to be changed with every dressing change. So we change, dressing change is every week. So this is to be in mind. We change dressing every week. When we change the dressing, we change the stat locks, whatever we are using, chlorhexidine impregnated pads like Tigaderm maybe. And then we need to change the cap as well of the catheter. Okay, so these are the three things we need to change every week. So, all right. All right. So we make sure these are, you see these arrows? So these go by towards the catheter because we really need the catheter to be here. All right. So these go towards the catheter. And you can see here, it's actually sticky. This is how we place it on the skin. So this is how it is. You see how? So this is how we remove it. The first thing that we need to make sure is we need to clean the skin very well. I'm not going to go into how to clean the skin. I think this is done here efficiently and you know how to do it. But we're going to go to do how to actually use it because we don't want to stick it on skin and then press on it because it's locking actually. So we need to press on the skin, on the vein, on the hand. So this is not very comfortable for patients. So we need to make sure that we do this first, all right? So this is, okay, good plan. I will go back to that. I just wanted to start from here. So this is how it should look like, a catheter inside a stat lock, all right? So this is how it looks. So we go back, one step back. We have done the cleaning of the side, the catheter is there, already, okay, let's move, because actually it comes, okay, when the insertion is done, let's start from the insertion side at the first time. The doctor has finished the insertion and then he asks you to place the stat lock. So basically this is how it's done. We need to come here, the arrows are towards the catheter or towards the patients, and then we take it without moving it from there, try to minimize movement, and then we place one finger below it, so basically we lock it, and then we move to the other one and we lock it, and then we remove this, we place it, and then we place whatever we have here over it. Okay? Is that clear?
Yes.
All right, that's good. So this is how to use tap locks. Again, I'm not going to discuss the cleaning part before placing the stat locks because it depends on the hospital actually. Chloroprep or alcohol do you use it? Yeah. Chloroprep. Okay. So that's actually excellent. This is excellent. We need to do that. And when we are removing it, just gently swab it with alcohol and then don't remove the catheter before you remove it. I'm not going to be able to remove it, I think. All right. Because this is plastic, yeah, okay. Good quality. We use good quality products, guys. All right. So I don't do that when I'm on the patient, of course, but this is plastic, that's why. So we remove it. We do unlock him. Okay, it's broken, which is fine because we are removing it. And then we clean again the skin. We clean again the skin very well. Make sure we clean very well. And then we change the stat look, we change the dressing, and change the cap, and that's it. And we do actually the flushing whenever we do the dressing changes. So do a flushing, block the catheter with the flush as well, with the normal saline as well, before you finish with it. All right, let's go back and do something. This is sliding now. Okay, so it comes with alcohol swab. This is how it is. Guys, one by one, please. Start from here.
Go.
Yeah.
What did I do? Go. No.
So this is the patient. Let's not stick it this time. Only do everything and imagine that we are sticking it, and that's it. Because everyone will need to do that.
Ilalak mo siya. Kanan.
All right. Excellent.
Ganda tayo gabi.
Excellent. Remove it, yeah, please.
Kanan talaga. Picture rin.
All right. Thanks a lot. Thank you. Who wants to do it again as well? Someone from behind. Can you please come in?
I will do it.
Yeah.
Yeah, do it. So after the cleaning, So after the cleaning part,
Yes.
and then I will put this on the arrow towards the patient. Then
Mhm.
after this one, I will open. Then I will put like this.
Of course,
then-
you will not do it on the ground. You will do it while your fingers are below.
Yes,
Yeah.
yes.
Do
Just
it that
like
way.
this. Then
No, I mean move it
Do it
up.
up.
Do
Move
it
it
as
up,
you are
please.
doing it over the patient. So place your fingers below.
okay,
Yeah.
okay, like this. Then
Nope. Wait.
yung
Move
upper
it up.
lash.
Yeah. So basically, you are moving the catheter, right?
Yeah.
Don't place it again. Just keep it up.
Like this.
No, keep it with your hands
Keep
and
it
your
with your
fingers
hand.
below.
Like
Yeah.
like this.
Yeah.
Kun mo.
You're doing correctly, and then don't place it down. So basically, keep it up. This don't get it below. Just keep it up.
Keep it up.
Place it this way and keep your fingers below. So basically, you can apply pressure
Okay.
while your fingers is down. So the catheter doesn't move much.
Okay, so like this, then the person this one, like this,
Yep.
and then after like that, the other side.
Perfect.
Okay.
Yes. And then you stick it, and that's it.
Yeah. Okay.
Perfect.
Remove.
And you then change the cap, and you place chlorhexidine, Tigaderm. Let's say call it Tigaderm, and that's it.
Yeah.
Alright? You do the flushing, of course. You do the flushing whenever you change the dressing. Alright? Who else from behind can answer this one? Can you please?
Dyan
Try?
na, remove it.
So this is on a patient. So first, when it is on a patient, don't remove it. First of all, you remove it as a whole.
Usually we use
Yeah, okay. Yes.
chlorhexidine also.
Chlorhexidine. Pick it up, yeah. Okay.
Okay, go.
You've seen this, right?
Yes.
This is the one that we use.
Line, decline, we use this one.
Taas mo, besh.
Alright. Actually, BD has another product.
Keep your finger below.
You hold like that. Hindi good. Ganyan. Hold mo siya ng ganyan. Yes. Yan.
Is it hard to deal with? With practice, you will be.
Lagyan mo
It
ng
will become
kamay sa
easier
likod.
not to move it. So basically, this is the first thing that comes to mind. We need to make sure that it doesn't move. The catheter doesn't move inside. So basically, we need to make sure that we are gentle with it and minimal movement. But we are for practice now. We're just trying to make sure that we do the clapping right. All right.
Okay.
Go ahead. Yeah.
Okay. So at first, make sure that this arrow goes to the patient.
Yep.
So you're gonna hold this one like that with your hands below. This
Alright.
one, your fingers, so that it's easy. And yeah, so the pressure will not be on the patient.
Yes.
And then you are gonna peel that this way like that.
Don't feel it.
Yeah, okay.
Yeah. Yeah.
Okay.
She did
When-
it so well.
Not.
Yeah.
It's not.
Remove now.
Yeah.
We don't have much. That's it.
Then when removing, you will just wet it with alcohol,
Yeah.
and then you're gonna like do like that also. Then okay.
Exactly this way. You're not moving the catheter.
Yeah.
Excellent. You
And
just
then
excellent.
Remove it slowly.
Excellent.
Then you're gonna do your dressing.
Actually, yeah, you can do this way
Okay.
and clean it. Clean, yeah, clean, yeah, clean every
Clean.
slide, everything, so everything is correct.
Okay.
Yeah. So-
Thank you very much.
May we use the adhesive remover?